Professional Philosophy of Health Education and Promotion, Nicole Happ. The health education promotion field offers many services to individuals and communities. As a health education specialist, you're responsible for assessing needs, resources, and capacity, planning, implementing, conducting research and evaluations, leadership and management, communication, serving as a resource person, advocacy, and ethics and professionalism. My personal philosophy is that I value having people being well-informed when making decisions that can affect them long-term, being open to change, and feeling safe to ask questions when needed. I will provide informative and helpful materials to clients so that they make their own decisions. I hold the ideals of providing skills to allow people to make informed decisions on their own health, as better their well-being and promote a healthy lifestyle, as well as teaching the means necessary to make health-based decisions. I regard being an advocate for and being respectful towards all people important, especially the aging population. I believe in cultural diversity, and I will encourage and celebrate diversity among my clients and make information available to them that best fits their culture and understanding. In the past, I've been working with doctors, nurses, and in the healthcare field with patients. It has all shaped my views on many topics with health and opened my eyes to how much things need to change in the healthcare field. As a health education and promotion specialist, it's a very beneficial role to patients and communities and needs to be more utilized. My career trajectory is to work in healthcare with patients. Doctors and nurses do not always have the time to answer questions fully for patients or explain to them topics, especially when they are first diagnosed with something. Health education and promotion specialists can bridge the gap between patients and doctors so that they can process information, come back with questions, and get all the information that they need. Contributions towards the field and my patients. I will serve as a resource person for patients who need information and communicate with them about their health and options. I will advocate for patients and support asking questions and receiving information about one's own health. I will inspire others to view people as individuals and understand their needs and capabilities, and not to view people based on one attribute such as age. I will celebrate culture and diversity and be enthusiastic towards contributing cultural differences and encourage others to do the same. Healthy People 2030 lists one of its objectives as increase the proportion of adults whose healthcare provider check their understanding. Everyone's health literacy level is different, and patients can be given all the information that they need, but if there's a lack of understanding, that can hinder their decisions and their continuing care. Everyone's level is different, and some people need more information than others to help understand it. Seeing this firsthand is a major reason I want to be in this field. I have so many patients that when I ask them why they're here for an exam or what they're getting done, they tell me they don't know, that they just want to come in because that's what the doctor said to do. And they don't actually know the reason or how it's contributing to their health. And I feel like that needs to change. The aging population is only increasing, and by 2040, the number of Americans 65 years of age or older is expected to be 80.8 million. This means that that population may require extra attention. Skills assessments and teachings may need to be involved in advocacy. The older population has needs that the younger population doesn't, and that needs to be recognized. I've seen so many patients miss appointments because they don't have transportation, and I've had to set up Ubers or public transportation for them. And Zoom meetings are also another issue for them. With COVID, lots of people switched to Zoom meetings, and the elderly population can't always navigate around that without help. So I would like to be able to help them in every category necessary so that they can better their health and understanding. The US alone is becoming more culturally diverse. Cultural competency is a big skill that needs to be part of health education and promotion. Programs need to reflect an understanding of cultures and diversity to reach clients. Valuing diversity and respecting other cultures is a must. Being conscious and mindful of different cultures is one way to help you have cultural competency, as well as preparing yourself for the diverse populations that you serve. Some ways in doing this is maybe you work in an area that is highly Spanish speaking, so you'll need to familiarize yourself with interpreting services, maybe learn another language, and offer paperwork in multiple languages. I've had to do that many times where I've had to set up an interpreter and I've met with them face to face, or there's many options to use tablets now where you can either phone or video tablet conference an interpreter to help you get through a scenario with a patient. You don't always know in advance, so it's nice to have the option and be able to use it. In conclusion, I plan on being the best health education promotion specialist that I can be for my patients and clients. I plan on working with patients in the healthcare setting. And in my current career, I find that patients need more attending to than is provided to them. Like I said before, doctors and nurses can't always answer all of the questions that patients have in the time given. I'll focus on my values of informed decision-making, respect, advocacy, and cultural competency to provide excellent services.